We turn now to a health alert this morning. Diabetes, asthma, pain meds, all in short supply recently. Now more than a dozen cancer drugs are currently in a shortage across the nation.
According to the FDA, doctors are sounding the alarm as they make life or death decisions for their patients. Our Noah Lonnie-Graff goes in depth on the impact and how to stop a shortage like this from happening again.
The choice to have chemotherapy is hard enough. Now, it may not be a choice for some. Chemotherapy drugs are under shortage. The list has grown to 14, according to the FDA. Already, some hospitals are having to ration their supply, delaying treatment for some patients, which could be life-threatening.
To tell a patient that we have this great treatment and it's going to work, but we can't give it to you because it's in short supply is really, I think, one of the hardest things.
According to a report from the Senate Committee on Homeland Security and Governmental Affairs, drug shortages across the board are at a record high. The report says new drug shortages increased by nearly 30% between 2021 and 2022.
We have not seen a shortage like this on this scale, at least in the last 10 years that I can recall.
Clinical trials that depend on these drugs could also be put at risk.
How is that going to impact the data if we can't give patients the drug that they need? So the repercussions are really immense.
Dr. Arif Kamal with the American Cancer Society says newer drugs don't generally face drug shortages. It's the tried and true drugs that eventually come off patent, which then allows other companies to produce generic versions, bringing in new competition, hurting the original maker's bottom line, ultimately incentivizing companies to make newer drugs instead, reducing production on the less profitable ones.
What is not clear is as a drug comes off patent, what is the strategy to ensure that there's a continued uninterrupted supply chain of drug that aligns with the economic incentives that a manufacturer would need to ensure that exists?
That'll require action from Congress. Angels for Change, an advocacy group whose mission is to end drug shortages, gave testimony in a hearing last month before the House Energy and Commerce Committee. Laura Berry, the organization's founder, testified transparency is needed to prevent drug shortages from happening. She also says collaboration is needed.
It includes the FDA. It includes the supply chain members. It includes the manufacturers and the hospitals. How do we align our incentives to get as many patients the needed drugs that they deserve? And that's, the one message I want to say. We need to be connected and collaborate, but then there needs to be tools of connectivity so we can scale.
The FDA says it is working with multiple manufacturers and others in the supply chain to remedy what's going on and help reduce the impact these drug shortages have. For your Health Insider, I'm Noah Lonnie-Graff, ABC 15, Arizona.